Right now, we are driving to the last known location of a person that had an overdose yesterday, and hopefully we find them. And if we do, then we can engage them and offer resources and harm reduction supplies.
The Opioid Response Team is a partnership between the Chicago Department of Public Health and the Chicago Fire Department that pairs a paramedic from the fire department with a peer recovery specialist, which is a person with lived experience of substance use recovery. And they do follow-up and attempt to engage people who've experienced a drug overdose in the prior 1 to 3 days and try to engage people in services that reduces their risk of a future overdose.
I knew I had to switch jobs because I was in construction and a maintenance man, and since my addiction started with pills through the doctor from an injury, when I had learned, I was in recovery and I had learned about the positions, and so I called the number that was in the flyers at the recovery home, and I started right away. I'm a professional, also having lived experience, so people tend to relate and understand the process better, knowing that I've been through it. So it's building trust, basically. And some people don't have no trust depending on what they've been through. That's basically the main values of what we try to do, and give people hope and understanding that they can have a better life.
The harm reduction model is the method that the opioid response team takes. The approach is centered around the individual. We kind of meet the person where they are, and we basically say, you are the captain of your ship. It's empowering for them to make the changes that they want, not the changes that our program dictates.
We need to be developing new ways to support people who are living with substance use disorders, reduce their risk of experiencing a future drug overdose. And the Opioid Response Team is one part of that larger effort. This program is really about engaging people in the community after a drug overdose and trying to redirect them into community care, structures of care that address their health needs, their social needs, housing needs, etc.
Anything in healthcare, when you are meeting people at their worst, you can't help but to connect. I mean, that's just the humanistic part of that. And we do empathize. We see the suffering, we see the isolation. Oftentimes, people become tearful. We're saying, hey, wherever you have been in the past, that's in the past. Your past does not label or determine who you are today. So let's move forward and get you to where you want to be, where you see yourself.